Okay, so the Hallowell comes with different sizes of bellow housings, and that's going to be based on the size of patient that you are going to need to ventilate. So this is the smaller bellows housing that will accommodate your smaller patients, and it will deliver accurate tidal volume up to about 350 mils. So if you have a smaller patient, you're going to want to change to the smaller bellow housing and smaller bellows. It is really easy to change the bellows out on the Hallowell. So there's two clips that are actually holding the housing in place. So you just need to turn it sideways, and it is a suction. So you want to flip that over. Now, these bellows, you got to take very good care because these can rip very easily. So you just want to gently grab them off, set them down. And then this unit just snaps into place, just like that. And then when you replace the bellows housing, you want to do so that your numbers are going to be in the front. So secure down, twist it, and then only 2 of the 4 knobs need to be tightened down. And that's it. Now you can use the bellows housing for a smaller patient. So you would want to pressure check this to make sure that the bellows go all the way to the top and hold before you would use it on a patient. So all of the connections for the ventilator are hooked up. We can push our flush valve and just pressure check our bellows to make sure that they are going to stay up. And that's all perfect right there. So that is good to go. We can use these bellows on a small patient.